Health experts and pharmacists have warned that the circulation of counterfeit and substandard medicines in Nigeria has reached an alarming level, posing a serious threat to public health outcomes, patent safety, and confidence in the healthcare system. This is as over 40 pharmacists from Niger, Nasarawa, and the FCT have undergone intensive hands-on training aimed at improving their ability to detect counterfeit and substandard medicines in circulation across Nigeria's pharmaceutical supply chain. There is more on that story.
Nigerian pharmaceutical supply chain has in recent years come under increasing pressure from falsified drugs, weak regulatory enforcement that exploit gaps in medicine verification and monitoring systems. These concerns form the backdrop of a hands-on capacity building workshop held for pharmacists from Niger State, Nasarawa State and FCT. Speaking at the workshop, Professor Sunday Awofisayo of the Department of Clinical Pharmacy, University of Uyo, said the initiative was part of effort to empower pharmacists to respond to the growing threat of counterfeit medicines.
The objective of this kind of training is to sensitize our colleagues, let them start to put a small unit of a drug assurance system in their pharmacies, so that those who are selling fake drugs will run away. All that we've been talking about is, as pharmacists, we want to ensure from all our drug outlets that once drug come in, we pick samples, do some basic tests on some suspected medicines.
The head of pharmacy department at the National Hospital, Abuja, Pharm Clara Adesola, said pharmacists must remain vigilant in detecting falsified medicines through routine visual inspection, packaging checks, and supply chain verification.
This is a workshop that's going to give us skills or make us acquire skills to further be able to identify spurious drug, falsified drug, or substandard drugs. This training we're being given today will also help us in doing some chemical analysis to be able to say this drug is genuine or not.
Workshop lead Dr. Abubakar Daraka explained that the program was designed to bridge a major gap in Nigeria's medicine quality control system.
What makes it unique is what can be deployed immediately. It's not something you wait, you need hundreds of millions to purchase, because those gadgets I mentioned are in the ranges of hundreds of millions. So there is need for sponsorship to do this training, and government should strengthen the capacity of NAFDAC and the National Institute for Pharmaceutical Research and Development, so that this capacity building and deployment of these initiatives can be scaled up and it goes everywhere in the nooks and crannies, because medicines are available in every part of Nigeria.
The zonal coordinator of WAPCP, FCT Zone, Pharm Dr. Tijani Muftahu, stressed that pharmacists, as custodian of drug safety, must be continuously trained and empowered to authenticate medicines before dispensing.
We want to ascertain the authenticity, the genuinity of the drugs that we are giving to our populace, so that all the problems associated with counterfeited drugs will be eliminated. So that is the essence.
Participants at the workshop also called for stronger collaboration with regulatory bodies, improved funding, and nationwide expansion of training programs to ensure wider impacts across healthcare facilities.
Reinforcing the laws that govern drugs, supply, distribution, and manufacture and sale, it's very, very important. Otherwise, the way it's going, I don't know. The government really needs to enforce more.
Yes, I will encourage patients and Nigerians in general that if they want any medicines, they should go to registered pharmacies. And when you take the medicines, also inspect it yourself to see that there's a NAFDAC number and the features of the drugs are not awful.
Another thing that government can do is to encourage drug manufacturing in the country. If we are producing more locally, we don't depend on exported drugs, and then they can easily regulate what they are selling here, not what is brought out from the system.
The capacity building workshop was organized by the West African Postgraduate College of Pharmacists in collaboration with the Bioscientific Research Group, Department of Clinical Pharmacy, University of Uyo.